Hi, my name is Mary Haynes, and I'm one of the nurses in the Mobile District. It's important for the mission and for your own safety to ensure you are healthy and well enough to deploy. For that reason, USACE has a medical screening process to make sure everyone who deploys is healthy and able to do their job. Make sure your medical screening and immunizations are up to date. Many deployees step out of their regular office jobs to work long hours in undesirable conditions for 30 to 180 days. Back before we had a formalized medical screening process, 2 to 3% of deployees were returning from deployments early due to health issues. Issues that put them, not to mention those that they may have been riding around in vehicles with, at risk. Yes, I know 2 to 3% doesn't sound like a big deal, but every one of you was selected to deploy because we need you. You may not be easily replaced. The medical screening questionnaire in IngeLink is required every 2 years for established PRT members and every year for rehired annuitants. One exception is the urban search and rescue cadre, who actually have to get a full physical with respiratory testing each year. The medical screening questionnaire is electronically encrypted before it goes to the USACE medical team for review and has HIPAA and Privacy Act controls to ensure that only the medical team sees your information. You can update your medical screening in your personal data sheet in IngeLink, after which you will get a deployment code. Those of you who will deploy will simply see a deployment code in IngeLink telling you into what environment, if any, you can deploy. The deployment codes are as follows. D, which means you are deployable to a field or office position, OCONUS, which is outside the continental U.S., and CONUS, which is the continental U.S. Note that if you're going OCONUS, there may be more stringent requirements based on where you're going and for how long. DO means you're deployable to an office position, OCONUS or CONUS, but not to the field. You're not able to be a quality assurance rep if you're listed as a DO, even if you're normally a QAR. The reason is the long hours in a harsh environment with little or no cover. DFC means you're deployable to a field or office position, but only in CONUS, which means all states and territories of the U.S. You might receive this code, for example, if you had a medical condition for which you may not be able to obtain the required medical care in a foreign country. DLC means you're deployable to an office position, but only in CONUS. ND means you're non-deployable. Sometimes there may be a note such as, not deployable unless there's electricity, because you have medicine that needs to be refrigerated or you need a CPAP machine. P means your medical screening is pending until you provide additional information from your own physician. You may receive this code, for example, if the USACE medical team needs to know why you are on the highest dosage of blood pressure medication. 9 times out of 10, talking to one of the doctors and providing additional information will clear you for deployment. NR means you were requested to provide more information and you did not. DM means you're on the urban search and rescue cadre and are up to date on your medical exam. It also means you're deployable to a field position, OCONUS and CONUS. Some reasons you may be found non-deployable are you're undergoing chemotherapy, if you have uncontrolled blood pressure or cardiac issues or asthma, if you have epilepsy or seizures. Note that I said uncontrolled. If you have such conditions that are controlled with medication, you still very well may be able to deploy. The medical team has a good understanding of what our mission is and is going to do everything they can to try and get you deployed safely. Do not leave your home station unless you have a current deployable clearance code and proper PPE. Many have completed the medical screening just prior to being rushed out the door, arrived at the ROFO before a clearance code was assigned, only to find themselves sitting and waiting in the RFO with an angry supervisor who has just received someone who cannot start work immediately. There have also been those who have arrived without the code being assigned, sat humiliated until it was assigned, only to be assigned a P for pending, which means that more information is needed from your personal MD. And of course, it's always on a Friday, or your MD is busy and you're not his priority right now, or my favorite, your doctor's on vacation. It's not a good way to start off with your supervisor. And for the record, let's be clear. In these cases, it's not the USACE medical team's fault. It's not your MD's fault. It's not the RFO nurse's fault. And it's not the supervisor's fault. You are responsible for ensuring an appropriate deployment code is assigned before you deploy. You should not deploy if you're sick or seriously hurt. If you falsify or omit important medical information, you may not be offered future deployments. Unfortunately, there will always be another disaster and your time to deploy will come again. When you deploy, be sure to bring your shot record. It should show a tetanus shot within the last 10 years and bring enough of any prescribed medication to carry you through your deployment.